We're live now.
Namaskar, Johar, good evening, and a very happy and Merry Christmas to one and all. I am Dr. Suman Sinha, Chairperson Vaginal Surgery Committee Fogsi, and your host for tonight's podcast. What is happening? It gives me immense pleasure. There is some problem. It gives me immense pleasure to welcome our dear Foxians, reward dignitaries, and our esteemed viewers in the 331 episode of Gyan Pravah, a name that beautifully reflects our mission of continuous flow of knowledge, a celebration of shared knowledge and wisdom through thought provoking conversation, and Foxy's unwavering dedication and commitment to academic excellence across borders, specifically empowering mind and enriching women's health through our theme Ek Rashtra, Ek Mission, Swasth Nari, Samriddh Vatan. It is also an incredible opportunity to welcome two iconic leaders under one frame. Dr. Syamal Seth Sir, Vice President East Zone Foxy, and Dr. Anand Sinha, renowned plastic surgeon from Eastern India, Director Dev Kamal Group of Hospitals, and President Hospital Board of India, East Zone. I'm truly blessed to share screen with them. The theme of our today's podcast is Mission Smile. It is about the organization which selflessly devote to rehabilitate and and treat children who are born with cleft lip and cleft palate. And for this, Dr. Anand Sinha, the plastic surgeon, he is going to tell us more detail about it. But before that, I would like to introduce our guest of honor, Dr. Syamal Seth Sir. As we all know, I've told earlier that he is Vice President Foxy East Zone. But apart from that, he is a great academician and surgeon of par excellence. But he is also a medical legal expert. And because of him, हम लोग आराम से सो सकते हैं रात को because he is for us each and every time. And recently, he has got a very, I can say, his organizational capacity is mind blowing because recently he's organized vice president conference at Kolkata, and that was superb. He had simultaneously arranged more than 8 workshops. Live workshops are undergoing under his command, and I also had the opportunity to conduct vaginal surgery committee workshops. So thank you so much, sir, for involving me in your conference. So, but and he is elected president of Bengal Obstetric and Gynec Society, and he has a क्या उसको बोलते हैं he is a man of I can depend upon it, the most dependable person in Foxy, I can say. And he is heart of gold, I can tell. I wanted to tell it, but now I have told it, sir. You are such a kind person that I cannot stop myself telling about you. So with this, I would like to introduce our Foxy president also to the gathering, because this podcast is actually conceptualized by our president, and it has been her ideas that he has given all of the chairpersons. We are 32 chairpersons, and each one of her has got one day in a month to organize one webinar, taking one influential person across the international also and across the country also. We have selected many influential people who are doing great work for the welfare of people. And so we are here. So thank you, Dr. Sunita Tandulwadkar, madam, for involving us and showing us the right path, so that we are now confident on this platform also. Apart from our surgical skills and everything, now we are here also as confident as you wanted. So thank you very much, madam. A little bit about our madam. Dr. Sunita Tandulwadkar is a committed leader with charismatic challenges. And this Gyan Pravah podcast series, as I told you, is a prestigious initiative solely conceptualized and executed by the visionary leader and unstoppable force in women's health. She leads 48,000 strong federation with unparalleled purpose and compassion. She is globally acclaimed IVF specialist and endoscopic surgeon who has transformed the impact of infertility care in India. She is Director Solo IVF Clinic Pune, Director Alif Regenerative Wellness Center Mumbai, and Chief IVF and Endoscopic Center Ruby Hall Clinic Pune. She has the credit of delivering India's first stem cell baby by injecting stem cells in the non-functioning ovaries. And recently, she has been conferred with highest academic degree, that is FRCOG by RCOG. So with this, I request our guest of honor, Dr. Samuel Seth sir, to welcome our guest, Dr. Anand Sinha, to this podcast.
Very much, Dr. Shuman, for all those kind words. I don't know whether those words are really applicable for me. Nothing. I am the Vice President Eastern and representing Eastern. That's great enough. And it's always a pleasure to represent Foxy in whatever capacity you are in. Now, Foxy is such a beautiful organization. So that's enough that we are doing something for Foxy. And welcome, sir, Dr. Shina. This podcast series is a brainchild, as Dr. Shuman already mentioned, of our Foxy President, Dr. Sunita Tandulwadkar. And this is a huge opportunity for the 30 committee chairpersons to organize one podcast every month for each of them. And the beauty of Madam Sunita is that except in 2, 3 or 4 cases, always she happens to be present at 8 p.m. every day to give introduction of this podcast series and to welcome the whoever guest it is supposed to be in that podcast. So that's a huge efforts from her as well. It's not very easy to be present every night, every evening at 8 p.m. at a particular time and attend a program. So that's great job. And our committee chairpersons, all of them are great workers, hugely enthusiastic, very much energetic, and I believe they all love these podcasts. And today, our own Dr. Shuman Sinha from East Zone, and myself, a Vice President from East Zone, and our guest, all from East Zone. So, to introduce Dr. Anand Sinha, he is currently Chairman and Chief Plastic Surgeon, Devanika and Devkamal Hospital of Ranchi, and President Hospital Board of India, East Zone. He has in his credits several awards, and I think whether discussion, whatever kind of discussion is going to be having between Dr. Shuman and Dr. Anand Sinha, I think it will be of immense help to all who have been listening to this event, who have been viewing this program. And I welcome you, sir, being a part of a Foxy podcast. This is our privilege and pleasure to have you. And I believe you can highlight and do justice to the mission, smile. That is the theme of this discussion of today's podcast. So thank you very much, Dr. Shuman. Go ahead. And I believe you are going to have a very good podcast.
Thank you so much, sir. Thank you so much for being with us today.
Thank you. Thank you.
So, beautiful smile is priceless. And our theme is Mission Smile. So, without access to timely intervention, babies born with cleft lip and cleft palate have to face a lot of hardship, from difficulty in feeding to speech to hearing and to psychological trauma. Lack of awareness and social stigma contribute to underreporting and delayed treatment of these cases. Organizations like Smile Train and Global Smile Foundation are helping to transform the lives of children born with cleft lip and cleft palate. To highlight more on this topic, we have with us a very prominent and prolific plastic surgeon, Chairman Devkamal Group of Hospitals, Ranchi, and President Hospital Group of East Zone, India, Dr. Anand Sinha, who is closely attached to these organizations. Sir, welcome, sir, to this podcast platform. Thank you, sir.
Thank you.
So now we will quickly go through the questions. And this is for the audience as well as for our 46,000 gynecologists across country. So our first question to you would be, sir, what is the mission of this organization and what is the name of this organization?
Thank you for calling me today for this Oxy meeting. Let me also say a few words about your president. I know her since last 38 years. We used to work together. In fact, we began practice together in Pune in 1997 onwards. And I'm privileged to be attached to this podcast today. Yes, the social stigma of a cleft lip and a palate child is tremendous. People try to hide, people try to find faults with the mother. But the best thing about all these things is that it is correctable. 99% of the kids which are born with cleft lip and palate probably do not have any other congenital anomaly. Hence, a simple surgery can put them back into the normal life and give them a beautiful smile. Now, there are multiple organizations all over the body, well, all over the country. Number one is probably Smile Train, which works in almost about 110 countries or so. It's a huge one. India being one of the leaders because we have more people born with clefts and we have more people. But the funding is very smooth, it's very transparent, and it's completely result oriented. If you've given a good result, you are going to get benefited. If the results are not good, you may not be able to continue with the same organization. Second thing is one does not compromise on the safety of the child also. All the Smile trained partner hospitals are supposed to have a highest level of anesthesia available along with intensivists and good quality pediatricians to support the children. Safety is the number one criteria for awarding a center for a Smile train surgeries. And the second, of course, is the skill of the surgeon. So I'm lucky to be part of Smile Train as well as Mission Smile, another organization, as well as Rotary Lion, who had faith in me and giving them their children for free surgeries.
Thank you so much, sir, for your dedication towards these children. So now I can understand who the people behind these organizations are. Um, who are the exact persons? They are from India or from abroad or some other place?
Right. Smile Train began in the US with two, three big businessmen getting together. And when they showed the result to the other people, more and more people joined. In fact, in the US, most of the people donating are the businessmen or those kids who have got a property inherited to them by their parents or grandparents. Most of the Bollywood stars are involved into charity. But now in India also, we began with Tata Motors. About 15 years ago, Tata Motors became strong partners of Smile Train. And now the list is endless because people know that these organizations do get things done and in a very transparent way. India, I believe, I'm not very sure about the details about that, but about 10, 12 big companies under the CSR activities are already supporting either Smile Train or Mission Smile. One thing I know, Mission Smile did sponsor about 400 surgeries at my own hospital, Devkamal, through Indian Oil Corporation and Indian Railways. IRCON is another organization, and I believe ICICI Prudential also. So bits and pieces, people come together to make a huge impact.
What is exactly the working model of these organizations? How
Ma'am,
do they
people,
work?
yeah, I'll tell you what. The partner hospitals are chosen in an area where there are a lot of cases, like what we have in Ranchi. When we began in 2008 in Devkamal Hospital, you would be surprised we were doing almost 100 to 140 patients every month. People right from 3 months of age up to the 65 years of age, those who are keen on getting surgery done, were being operated.
Up to
And
65
then,
years of age? 65, you said?
yes, one lady came with a cleft lip and we asked her, Ki, do you really want? Yes, I also want to look better in my life. And we did the surgery. Of course, under local anesthesia, because elderly people we can do in local anesthesia. It took me almost 5, 6 years to clear off the backlog of Jharkhand itself. And then we realized that yes, now we have come down to about 40, 50 in a month, because the rate is out of every 700 live births, one child has a cleft. So we did a back calculation on this in the state of Jharkhand. 400 kids are still born every year with cleft lip and palate, and this mission will never stop till we find a reason why these people have a cleft, and that can be stopped.
So
The
still we
funding,
don't have the reason, na? Abhi tak we don't
no.
have reason. Oh,
We don't
okay.
have a reason. There was a study in Banaras as well as in the US that trying to find out a gene for this, unable to identify the exact gene, and never blame the mother for that. Once you blame the mother is literally sent out of the village also. So we don't blame the mother at all. It's just a matter of chance. People used to blame eclipse. That if the mother or somebody in the family is cutting vegetables during the eclipse time or during the Grahan time, so some of the people who came to us early on were called Gahanus. We changed their names after surgery was done. And now the surgery is sponsored by these organizations because they receive donations from all over the world. A fixed amount is there. Sometimes it's good enough, sometimes it's not good enough if you have a difficult case. But overall, if you see the balance, this is a perfect balance of what a support should be and what our aim also in life is to change people.
Very nice. So nicely said. So how sustainable cleft care can be achieved?
Very sustainable. See, in India, people are still not very keen on donations because donations are being misused. In our own state, Jharkhand, we have heard that the CSR teams are not doing their jobs properly. In fact, the money just goes into rotation and comes back to them. But if people really work hard on this, identify places where they have to support us, cleft is only one aspect. There are multiple aspects where they can support us. One of them is also carcinoma breast, where we are working on. In fact, our own Rotary Club has just got a big van from CCL and another support so that they could work on it and identify early breast cancers in the villages through a mobile van. So, if people come forward with CSR activities with the right organizations to work with, it's a wonderful thing. We may not require government support at all for these corrections. But people do have a suspicion that this organization may not do justice to the money that they are donating. A sense of disbelief is there. Overall, it's quite okay. We are doing fairly well with these people.
So, but government is supporting apart from
Government,
these.
yeah,
Yes.
government is supporting because cleft lip and palate is also covered in the Aishman Bharat scheme. Unfortunately, whenever we hold a camp in a remote areas, out of 100 child, if you have seen with a cleft lip, only 25, 30 people have their Ayushman card. The other also may be very poor, but 7 years down the line since we began Ayushman, still we have not been able to reach the last person to make an Ayushman card for them. And it's difficult. It's
So,
people sitting, yeah,
people holding this Ayushman card, they are treated free. Otherwise, also that
absolutely.
is free. Otherwise,
Absolutely free. You just have to walk into a hospital and get these things done. But they must be slightly wary about the fact that they're going into a hospital where a good and experienced doctor is going to operate on them.
that is more important. A good
Yes,
experience,
yes.
doctor. So, what is the requirement of international comprehensive cleft care to ensure holistic, sustainable outcome? I think you have already answered about it.
No, I can just put forward a little more on this. See,
Acha.
surgery, yeah, surgery is only the first part. Let me enlighten all your Foxy members. Number one, cleft lip we do at the age of 3 months or above. The child should be 5 kilos with no URTI or any infection of the sort, no pneumonia. He's taken up for safe surgery. We operate on them and send them back the next day. They come back after 6 days and we remove the sutures. Mothers take care. That's all about cleft lip. Cleft palate, start operating when the child is 8 or 9 kgs of weight at the age of 8 or 9 months. The aim is to do the surgery before 1.5 years so that they learn to speak properly. Palate, the muscles have to be reoriented by good surgery so that we create a new muscular sling where the child can speak properly. If it is delayed, then there is a problem. The child has a defective voice for all his life long. But
Speech
now
therapy?
the
Will
pardon,
which is speech
speech,
therapy
yes,
help?
it does help. But people say that after the age of 18 years, the memory is already enriched in the brain that this is how I have to speak. It's difficult to reorient the speech area. So 1.5 year is the upper deadline for do all palate surgeries along with palatal fistulas. But it doesn't stop there. Most child of cleft lip and palate are going to have a hypoplastic upper jaw called maxilla. It doesn't grow. So once they become 6, 7, 8 years, we involve the orthodontics with us. They take an impression and they design an expansion technique for them. So with 6 or 8 months of expansion, the maxilla which has already gone down can come forward. This is the best part of dentistry which is involved with the cleft. And then if there's no teeth erupting, we do something called alveolar bone grafting also. So all said and done, from the time the child is born and up to 18 years of age, we keep them under close supervision. Anything required, we do on them. And fortunately, most of the organizations are definitely supporting the surgery, lip and palate, and also the dental part.
How common is lift and palate together?
It's almost 1 in 2,000 children.
1 in 2,000. So I have seen many girls who had undergone this cleft lip or cleft palate surgery, and I could not make out that they had the surgery earlier because so fantastically you all have repaired it. So I was really wondering that there's no deformity when you look at their face without knowing the history. I cannot make out neither their speech. So,
We thank God for that. There is a little scar on the upper lip, which
but
they
now,
can very easily hide with a little bit of a makeup.
yeah.
Sometimes a bit of a nasal deformity, which also can be corrected. One of the film stars, Aisha Takia, I don't know whether you remember the name. No, she's not no more in the films. She had a cleft lip and she had marvelously hidden her scar and she became a top heroine in her times. But yes, colored people, what we are, we do show a little bit of a scar. But the people who are very fair, hardly any scar is seen. If a
See
good
girls
surgery has been
only.
done.
I've seen
Yeah.
most of the girls and I could not make out.
Yeah.
When they
Yeah.
told me, then I could guess. So, sir, how can gynecologists support you all in this mission?
Yes. The treatment for cleft lip and palate starts immediately on the very first star. As you all say, colostrum has to be given as early as possible. If the mother is not able to feed the child, please remember, all of you, the mother not able to feel the child with a defective palate, the child cannot suck on the nipple. We advise the mothers to express the milk out into a container, obviously a very clean container, and with katori and chammach. This is what we always talk to the grandmothers and the other members of the family. Katori and chammach, the child is fed. Preferably, the child should be given mother's milk as long as she can suffice. Once the family feels yes, the mother's milk is not enough, you can add milk from outside. There's a strong feeding advice. The child has to be held at 45 degrees angle when feeding is being done. Otherwise, he may choke and also go into aspiration. Thirdly, normally we feed a child, say suppose about 40 ml of milk, and we keep them on the shoulder for them to burp. So about 10 to 12 ml of air comes out with the child has swallowed along with the milk. Now, in a case of cleft lip and palate, instead of 10 ml, 20 ml goes inside because there is a huge area there from where the air can go along with the milk. So once the child has taken 30 ml with a capacity of 50 ml stomach, in which 20 ml is gas, he says it's enough. I cannot take any more milk. एज अ रिजल्ट पीपल से बच्चे क्लेफ्ट लिप पैलेट के होते हैं वो कमजोर होते हैं, कमजोर नहीं होते हैं, वो कमजोर बन जाते हैं बिकॉज ऑफ रॉन्ग फीडिंग टेक्निक्स। सो वी स्ट्रांगली एडवाइस, आपने एक फीड दिया, आधे में बच्चे को रोक दीजिए, पुट हिम और हर ऑन द शोल्डर्स, लेट्स टॉक हर ओनली, लेट्स पुट हर ऑन द shoulders till she burps, 10 ml air goes out, and if you start refeeding, instead of 40 ml you might be able to push in 45 ml of milk, which is too good for a child to grow. Simple techniques have to be followed. Whenever a child comes to us, the first meeting, we teach them what exactly is feeding advice and how can you build up your child without medicines.
So nowadays, because of anomalies can be do between 14 to 20 weeks, and we can very well know that the child is suffering from cleft lip or cleft palate. So how to convince the mothers? Because we write on the
True.
report and they become very much anxious that what to do now, because still it is early pregnancy. So we should I think we should counsel them that after birth this anomaly can be very well corrected, and don't worry about it.
Uh,
How to
it's I'll tell you what. Initially, we used to get one in a year. Some smart parent goes to a big center and get an anomaly scan done.
now
Now
to
it's almost two, three in a month. But thankfully, all the gynecologists refer to us as early as possible. We call them to the center, talk to them. Number one, your child, even if he has a cleft lip and a palate, is going to be born as a normal child. It's a very simple surgery, and it's your own child. Hang on. We've heard instances also of abortion. Please do not do that, because it has been noted that people born with cleft lip and palate usually do better than their colleagues in classes. Usually do better. Number one, because they feel they are handicapped, they must work hard. Number two, the parents also who are smart enough give them more attention. So we just call them, talk to them in a very light-hearted manner that this is your baby, go deliver the baby, come to us, we will do something about it. Two centers in the US are starting with intrauterine surgeries. The scar is nil because we have a type 4 collagen when the child is born, which changes into type 3 and type 2 once the child grows up. Believe me, they have tried this, but it's not been easy. There have also been complications. So discourage them, encourage them to go for a nice, good delivery, be it LSCS or a normal delivery, and come to us as early as possible so that the feeding is advised and we give them a date for surgery.
Yes, so this is for the mothers, because our viewers are also common women are here attending your talk show. So now they might be convinced that there is no effect on the intelligence also. Your child is equally intelligent as others are, and don't ever think about aborting your child.
Yes.
Even you know that the child is suffering from cleft lip or cleft palate. So what effect these organizations make to educate community, what we're talking about, to prevent cleft lip and cleft palate? Is there anything to prevent?
Not so far. Hypoxemia was supposed to be one of the causes because most of the clefts of being found in the Tarai area where they were burning the firewood. Thanks to the policy of the Prime Minister that we are doing away with the firewood and the gas is entering almost all homes now. So ladies have to struggle a little less on the chula than it was initially done. The instance supposed to be dropped down. We haven't had a new census now, but yes, nowadays we do not see so frequently cleft lip and palate, also because we cleared the backlog. But there is nothing like that that we can prevent. If the first child has already had a cleft, we tell them to go for anomaly scan for the second child. That's all that we can do. Sometimes we have had three girls with cleft palate and done surgery one after the other for all these things. But I repeat, we must thank all these organizations like Smile Train, Mission Smile, and there are multiple of them. We have one new one coming to Ranchi, ABMSS also. They selflessly support your program with two conditions. Surgery has to be safe, and number two, you have to be a good surgeon to give good results.
This folic acid and all won't help.
People say it helps, but folic acid is as such now given to almost all the children and all the mothers, and it's come free from the government. So we're also very happy. Just tell them, लग रहा गड़बड़ है, जाओ आराम से PHC में अपने जाओ, अपना रोज एक गोली folic acid खाते रहो. It seems to have worked, and also
So
because
diet
now
and folic acid.
yeah, mothers are being fed properly now. I mean,
And they are aware also. Now they are aware. So how social media can improve cleft lip and cleft palate awareness is very important. So how we can help to aware.
tremendous. Before social media became very powerful, let me give you an example. In April 2010, we could somehow rope in MS Dhoni to give a small ad for us for the cleft. He readily agreed, did not charge any fees, and he gave us a 1 minute 20-second video. You can just कि आप किसी बच्चे को कहीं देखें तो इनको बताएं आप किसी की जिंदगी बदल सकते हैं and all those things. He just said that in a very plain, simple manner. We went to the social media, held a press conference, and you will be surprised in the next 2 months, I did 360 surgeries.
My God.
And then we kept telling Dhoni that when he won the World Cup in 2011, there's a strong role of the blessings of all these parents also, which went along with him.
Yes.
So, if people talk about these things in social media, 3 महीने का बच्चा हो जाए कटा होट तालू है, go to the nearest mile train center or whichever your doctor refers to, just go get surgery done. These things, and once they come to the hospital, we enroll them onto a cleft program. We do not let them go anywhere else. अब हो गया, आके दिखाते रहोगे, or you're from this place, we're going to hold a camp in August, September, whenever the date is. Please come there and show us there. And then you should see the face of the mothers when they come with the child and their arm who is smiling. They come with small, small gifts like थोड़ा vegetable अपने गांव का लेके आते हैं. They feel so happy about it, and we don't say no to that. So this is something which has made me and my other colleagues in this country almost demigods for these people. It's free.
You know why I took this topic, because nowadays what I see everywhere in my city in Ranchi, the hoarding is there. Smile train, let this Mrs. Smile or beautiful smile is precious. It is written, and that I have copied here. And then I thought this would be the best topic to talk in my last podcast, because it is an awareness program. And with you, I'm really happy that you got a right person to tell me the right thing. And this awareness is coming from the community itself, because everywhere you see the, if I am a I was influenced and I got interested to talk about this topic. So हमारी जनता भी देख रही होगी कि ये चारों तरफ क्यों लगा हुआ है, because our government is keen to help, and just this, the government is trying to make aware each and everyone, so that whenever we see any family having this type of child, we immediately go to them and tell them, go to the smile center and your child will be like any normal baby, so don't worry. And I think that was the mission of putting these hoardings across the city. So we come to the next question now, I think. Uh, how to become a member of this organization? Many people would like, because after your talk, maybe many people would like to ask me how to become member to help these children.
Right. It's very simple. Everything is now online these days.
Yes,
You
sir.
just have to click on whichever organization you want to support. They have a fixed amount, like in the US, it's about $300 for one surgery. And $300 is nothing for people earning in the US.
Yes.
It's almost like we spend around $500. So you just have to join them. You may join them financially and support them financially, or even support them as a volunteer when there is a camp going on. Or you can just join. You can look into your network of hospitals which are close to your place. Just go and offer your services. Yes, I'm going to be here if you want to hold camps, or I have a soft media presence. Can I talk about you or not? That's good enough. We still need a lot of awareness programs to happen, and the soft media is now a big thing. Every person now has a smartphone and is hooked on to either YouTube or those reels. We are going to make a few reels also about these cleft children, and I feel I should be able to turn around the whole. in the whole scenario.
But you talked about joining from US. What about we in India want to join your association? How can we help?
No, it's very simple. Just have to go onto the online websites. You find out which is the network, the next center which is offering free surgeries close to to your house or place of work. Just send them a word that I've just seen this, that you are a member of Smile 10 or Mission Smile, and you wish to and you are wish to contribute to the awareness program or the surgical program. They are most welcome. So if you click on the Smile train, they might say Ranchi, this hospital. Just go and join the hospital. Come and meet us. We'll be able to help you out.
Thank you, sir. Thank you so much. What is the source of funding now? Because we are talking about it, but from where the fund comes? Because
Uh,
you
I
must be
believe
paying to the surgeons, to the volunteers
yes.
who are working. They might somebody might not need any money, but others, I think, they need some
No, see, not
price for the
in
job.
this yeah, in this world, nothing happens without money.
Hmm.
There is practically no free service anymore. The
Yes.
surgeons who are attached to this are not given the money for surgery. It's just that they've taken term from their skill and done a surgery and looking after the child. The amount of money that one should get for a cleft lip surgery and what is being offered by these organizations, there's a difference of almost 500%. But the surgical part is, I mean, the surgical fees is low, but the inner happiness is tremendous. You do 5 surgeries in a day and you just sit back in the evening, go home and relax. Today, I have been able to change 5 families' lives.
Life.
The child is not aware what's happening to him. He's only about few months and a few years old. But the family, they go back and they talk. My God, we did not spend any money, and the child has become absolutely normal. This is the kind of thrill that we impact through these organizations. Most people in the US, at least, people do donate. Even the Muslims during the Ramzan period, they're supposed to donate 10% of their earnings. Some do, some do not do. But during Corona, both the support had gone down pretty badly. But now, once again, we have picked up. And each organization which is helping us out are doing fairly well because of the strong donations coming from the right people.
Sir, one personal question from you. Sir, what came into your mind that you became a member of this organization and started doing cleft lip and cleft palate? I know you are a surgeon, but how did you dedicate yourself to this organization?
See, when I was being trained at PGI Chandigarh in 92, 94, we used to have 3 to 4 clefts every morning.
Every
Each
morning.
operation theater, the list was like 3 or 4 clefts, and we had a waiting period of 3 to 4 months also. PGI was probably the only center that time in northern India with cleft facilities. And I was lucky enough to assist almost about 1,000 cases before they gave me the first case to operate, almost at the end of the MCS training program. That also helps you. When you keep seeing so many things, and then finally, when your turn comes, you can do a good job out of it. So when we came out, I decided I will definitely dedicate myself to these surgeries also. When I came to Ranchi in 2001, the Rotary clubs, the Lions Club, we were offering just 4 surgeries every month because that's all they could afford. Then suddenly came Smile in 2005. And we had Mr. Kalra, who's no more with us, whom I feel has been the brainchild behind the Indian Smile Train. Now, few ladies are carrying it forward. Mr. Kalra just met me in a conference, and I told him that if you board me onto Smile Train, in 6 months I'll finish off everything and probably do the same thing what I'm doing. He just held me by the hand and he said that there are 10,000 clefts in Jharkhand. If you start doing 3 per day for the next 10 years, you will not finish. And believe me, it's been 22 years now that I've been doing all these surgeries. Tomorrow morning, also, we have one palate and one lip with us. So this is unending. Besides the number game, if you have the number, then the earning also becomes fairly good. But much more than that is the inner strength which gives you हाँ, मैंने आज 5 जिंदगी बचाई है जिसके लिए मैंने पढ़ाई की थी। पैसे और जगह से भी आ जाते हैं. We do a lot of cosmetic work. There's enough money there also. But yes, there's a more of a thrill than anything else in this.
This Smile Brain Foundation, what else do they support apart from cleft lip and cleft palate?
At the moment, I'm not aware of anything, but some organs have also supported post-burn deformities.
Acha.
We have yet to get log on to any one of them. We are doing a post-burn deformity through the crowdfunding called Keto and all. We send them a picture, a girl with a deformed face, or acid burns. Fortunately, acid burns is now covered under the national government policy that everything is being done free of cost. But I think besides cleft lip, most of them are not supporting anything else because there's huge amount of numbers to be done in the cleft lip and palate itself.
Any screening program you all are taking, like cancer,
No,
breast cancer
we
screening?
just we just hold the camps. I've been lucky enough to have few people in the bureaucracy helping me out. See, if the district commissioner is very keen or the district magistrate, he can order his staff to do a survey, find out the number of cleft cases that they have, and then refer it to us. A few names I can easily rattle off. They'll be very happy to have learned that I've mentioned these. One was Mrs. Imani Pandey, was the DC of Hazaribagh, then Jamshedpur, then Gumla. She must have given me close to 2,000 cases of cleft. She knew that I have to identify and send to the right person. She did that. Similarly, Mr. Ravi Kumar and Mr. Prashant Kumar, all these IS who were there, DCs in their heydays, have done a tremendous job. So, is the government policy if they decide to identify, no cost involved, it comes to us through RBSK also.
Thank you so much, sir, for enlightening us on this very, very important topic. And anything more you want to tell us?
No, I would invite the gynecologists to come down and see a live surgery being done. Believe me, and when they go out and meet the parents, even the gynecologists have a small tear in their eyes. It is so rewarding. That's about all. Support us, support the families. Whenever you see a cleft, report to us as early as possible so that they come to us and they know what exactly the procedure, what is the feeding advice, and how much time it's going to take to us to work with us, and how many visits they have to make to the hospital also. And we look up to the NGOs working in Jharkhand as well as the activities of CSR to come forward and support all these programs. There's a lot of work to be done in Jharkhand itself. Forget about the country. Lot of work. And Smile Train and Mission Smile have centers all over the country. You can just join them and carry on the good work.
Sir, the pregnant ladies, when they come to know about their unborn child, that he or she, the child is suffering from cleft lip or cleft palate, can we send to your organization to just give them a word of comfort or
As
praise?
early as possible. Once the mother comes to know, the whole family has sleepless nights.
Yes,
And
that I
then
was
the
thinking.
problem
How to
is,
counsel them? Yeah.
या पिछले जन्म में पता नहीं क्या पाप किया था कि ये होने वाला है. We just call them and says कोई पाप पुण्य कुछ नहीं होता. This is a normal thing which is happening to your child. Hang on, keep meeting us. I sometimes call the father to the OT also. आपको दिखाते हैं किस तरह हमारे एक ऑपरेशन हो रहा है, वो भी देख लीजिए. बच्चा छुट्टी जा रहा है, वो भी देख लीजिए. We just have to convince them that this is something near normal and the child will be absolutely fine. We've All those who have come to us with a pre-delivery scan have come back to us for surgery. That's a moral victory for us.
So I think with this we came to know a lot about on this topic, and I think our viewers are very much enlightened, and they now know whom to refer, when to refer, and where to go for the counseling, and don't hesitate in consulting to your surgeon. Um, Everybody is there to help you, right from government to the organizations, and so don't make yourself that you have done some sin. There's not a sin; it's just some anomaly, some genetic anomaly which can happen likewise without your fault. So don't take it as it is your fault, and that is completely treatable. As Dr. Anant was telling, time will come that it will be treated inside the womb. So the days are going to come. We are looking for that to happen. But still, when as soon as baby is born, because it is only 3 months, the treatment can start for the cleft lip, and cleft palate is 8 months. So before your child is 1 year old, it will he or she will be treated. So we should not be worried about it. And thank you so much, Dr. Anand Sinha, for enlightening us on this topic, which was rarely discussed amongst us. It was so important because cleft lip and cleft palate many times we have discovered, but we have never talked about it. So I think this was right time, right platform. And in this last podcast, I could come to you, and you have told us in detail about each and every details about it. So thank you very much for coming to Foxy platform. Thank you so much, sir.
Thank you so much, ma'am. It was a pleasure. Thank you so
Thank
much.
you. Thank you so much, sir. With this, we come to the end of our podcast.